Dear viewers, welcome to the fundraising drive of Global Health Network by Dr. Bob Achura.
Step back and say Global Health Network started way back in 2008 as a think tank in the United Kingdom in Scotland. And this was started by a team of scientists who initially were kind of activists trying to advocate for equity in health, advocating against inequality, especially in poor countries. But later down the road in 2009, a team of us who are from Africa kind of influenced or negotiated with our colleagues in Europe and in the US and kind of suggested we needed to start a Ugandan chapter, a program that would translate into improving the lives of the vulnerable people in Uganda. And like I said, these were a team of scientists who specialized in global health, more so in child and maternal health. This then translated into a registration of a non-profit, non-governmental organization in Uganda, which we are now calling Global Health Network Uganda, that focuses on primary health care with a specific interest in child and maternal health. Now, having looked at the entire country, we did realize that northern Uganda had just come out of the war and most of the infrastructures have been destroyed during the war. Human resource for health, drug stock out, and so many indices in health prompted us to come. Now, looking at why we decided to focus in Oyam to implement this program. Oyam, if you look at the health records or statistics, has been doing very poorly in terms of child and maternal health. Actually, in the last 5 years, it's had the highest level of child and maternal death in the region. And because of these poor indices, we thought we needed to start our pilot project in Oyam, targeting the women and children who are very vulnerable within the Oyam rural setting. And what we have done so far, we are implementing a project concept that works through women health groups. Now, these women health groups are facilitated twice every month by the village health teams through different activities in a project cycle. And this entails thematic areas in sexual and reproductive health, sanitation and hygiene. Now, one fundamental thing we need to realize is that the women health groups that we have participating in this pilot project in Oyam are 415 in number. Now, out of these 415, 75% are women who are either expecting and has recently delivered. Now, looking again at the statistics of those who have recently delivered, over 92% of this group of women have delivered in life facility because of our door-to-door approach of intervention that we have initiated among these communities. Little support from the founders of this organization, and of course we've also had an American team that have come in to educate these women with the sexual and reproductive health, sanitation and hygiene program under this context. We, as you might have witnessed in the field, Oyam is basically a rural town, and the rural settings have extreme challenges with infrastructure. The health facilities do not have health workers. Even where the health workers, in most cases, they are not there within the facility. So the clients or the patients who visit these facilities have over the years gotten frustrated and avoided going to these health facilities, and that translated into the high number of deliveries that take place at home. It tells you why a high percentage of these women die because of child-related death. There's also a challenge of transport. If you have looked at these infrastructures, not many private entrepreneurs are willing to put their vehicles to commute within these areas, and that therefore poses a challenge of transport for the communities who may want to use these vehicles to access health facilities, or in most cases for referrals. The districts have ambulances, but because of funding challenges with the local government, it's right to say that 99% of the time these ambulances do not have fuel to run and help on emergencies. And because of this, often when communities call for emergency help through these ambulances, they requested fuel, which is very costly. All these compound reasons why our communities do not go to health facilities to seek for health care. Now, as Global Health Network, we've again come up, in addition to the pilot we already did, with another project concept that we've discussed at length with the district health team. We have consulted the communities. We are currently finalizing on the feasibility study, and we are soon presenting it to the political team to hone the project idea. The project idea basically wants to address the issue of transport, especially for mothers and children in need. And you're planning to start the implementation of this program possibly by December this year. What we are going to do through this scheme is going to be an ambulance insurance scheme for the community, where each house in Oyam will be expected to pay 4,000 shillings a month. That translates to 48,000 shillings a year. And we are targeting 5,000 households for a start for the pilot step. And this will entitle them to what we shall give them. It will be called a benefit. Each household will be entitled to a 24-hour ambulance service, which will be equipped with the state-of-the-art equipment for first aid, and the ambulances will also have life, and this will be operating for 24 hours. And we anticipate that through this initiative, we should be able to do away with the challenges that most of the vulnerable women in the rural setting have raised of transport to the health facility, especially during emergencies when they're in labor pain. They cannot sit in motorbikes, they cannot sit on bicycles to travel at night. So we think this should be a project. Again, like I said, we still have challenges with funding. We know the contribution from the community should be able to adequately cover the operational cost for this program. Rental cost, that is a capital, which will require us to get buses and one motorbike. And again, we are still appealing to development partners and corporate institutions to come to our aid to give us support with the procurement of these ambulances and motorbike for us to be effectively on the road by December to start implementing this program. The feedback we already get is overwhelming. The communities are telling us at anyone to an health facility agency, they pay between 30,000 to 50,000 a motorbike ride, which is commonly known as border, which is not the best means of transport. And they cannot wait for Global Health Network to start this initiative. And we think this in kind of providing a complete into solving the situation of child and maternal health in the Oyam district.
We invite all well-wishers to support this cause and to donate generously. Thank you for viewing.
What